Hello, welcome to this video. My name is Christiana Amaosisera. I'm a public health practitioner. In this video, I would like to talk about the main reasons why we get urinary tract infections and why sometimes the infection goes and keep coming. Okay, so what are urinary tract infections? Any infection that affects any part of the urinary system. And the urinary system includes the kidneys, the two ureters, the urinary bladder, and the urethra. So the kidneys make the urine, then the urine will pass through the two ureters into the bladder. So the urine is temporarily stored in the bladder, then it moves through, when the bladder is full, the urine leaves the body through the urethra. Okay. And typically, urinary tract infections affect the lower part of the urinary system, which is made up of the bladder and the urethra. And if you get such infection, urinary tract infections, that is affecting the lower urinary system, and you do not seek prompt medical care or appropriate medical care, it could spread upwards to the kidneys and damage your kidneys. So that is very important to seek medical care. And in some people, urinary tract infections can be recurrent. Even after treatment, they get well, and then after a month or two, the infection comes back. Typically, if you are diagnosed with urinary tract infections for 3 or 4 or more times in a year, it is termed as recurrent urinary tract infection. So if you are diagnosed with urinary tract infection 3 or 4 or more times in a year, then it will be termed as recurrent infection. And this is very common among women of all ages. Men can get urinary tract infections. However, mostly theirs is caused by something blocking the flow of urine. So it could be kidney stones or enlarged prostate. Yeah, when it comes to men. So if you experience any of these signs and symptoms, you may be having urinary tract infection. The first one is painful urination. So you feel pain as you are urinating, or you feel a burning feeling or burning sensation as the urine begins to come out. Then your urine color could be cloudy in appearance. Then your urine could have a foul smell, very strong smell, which is very unpleasant. Then you could also have a frequent urge to go and urinate. And each time you go and urinate, you realize that you only pass small amount of urine. But then when you come back, you leave the bathroom, you come back, you still have the urge to go back and urinate. So it keeps coming and going like that. In women, they could have abdominal or pelvic pain as well. So, and sometimes too, if there is blood in the urine color may be bright pink or dark colored. Yeah. So all these signs and symptoms point towards, urinary tract infections. Now, let's look at the risk factors or certain things that we do or have which increase our chances of getting these infections. The first one is the anatomy or the structure of the urinary system. In females, the urinary system, in female urinary system, our urethra is very short. Our urethra is 3 to 4 centimeters long, and that of men is 20 centimeters long. So you can see that ours is very short. Because of this short length of the urethra, any bacteria that gets in there has only a short distance to cover to reach the bladder and cause infection. So that is why, the women are more prone to urinary tract infection. So it means if there is any bacteria either in the vagina or your anal area, then it can easily, get spread to the urethra, and then it ascends to the bladder to cause infection in women. The next factor is genetics. Research has shown that some women have their cells are naturally more receptive to bacteria. So this means that there is some genetic variation in the cell receptors, which makes them more acceptable to the bacteria, any bacteria that goes in there. So what this means is that these women, their normal body functions are not able to flush out any bacteria that gets in there. So it ends up causing infection for the woman. The next point is sexual activity. Yes, sexual activities could cause urinary tract infection. Sexual activities, are the most common causes of urinary tract infection in women who are, premenopausal, or women who have not reached their menopause yet. So during sexual activity, bacteria could be spread from your partner's genitals, from his penis, from his scrotum, from his fingers, from his tongue, or if you use sex toys, bacteria could be spread from that to your urethra. So it tells us that men also have a key role to play to prevent, urinary tract infection in their partners or in women. Sometimes men, they feel, oh, we are men, so they urinate. If they are not using the washroom, they urinate by the roadside or in the bush, wherever. They touch the penis with their contaminated hand. And contaminated hand in this case, if you've touched money, if you've touched doorknobs, if you've touched surfaces, anything, and you've not washed your hands are contaminated. So you touch your penis with the contaminated hand, urinate, and then you package your thing again. Then when you get home, you want to be intimate with your partner, you need to at least take a shower, so that, or you wash your genital area with soap and water to ensure that every germ or bacteria that may be there would have been flushed out before you become intimate with your partner. During sexual intercourse too, the woman's own bacteria from the vagina and the anus could be spread into the urethra during sexual activity. So that is how sex increases your risk of getting urinary tract infection. Then the next point is menopause. After menopause, there are so many physical changes that happen in the urinary system, and these changes increase a woman's risk of getting recurrent urinary tract infections. The first physical change is a natural decrease or natural decline in the good bacteria in the vagina, which is known as lactobacilli. The lactobacilli produces acid, which keeps the vagina pH low or acidic, creates acidic medium, so that the bad bacteria that may be there will all die. So they are not able to thrive and then cause infection. However, as you hit menopause, this bacteria level reduces. The next change is that estrogen level reduces during menopause, and estrogen is known to help this lactobacilli to thrive in the vagina. So once there is little amount of estrogen in the woman's body, it affects the level of lactobacilli in her vagina as well. Then the next physical change is weakness of the bladder muscles. So once you hit menopause, the strength of your bladder, the muscles in your bladder reduces. So the bladder is not able to contract fully or contract with that strength as it used to be before, to be able to completely empty itself. So when you urinate, there is usually a residual urine left in the bladder. And the longer this urine stays, the more it allows bacteria in there to grow and cause infection. Then so there are, I mentioned, 3 major changes, physical changes, that contribute to increased risk of urinary tract infection in women who have reached menopause. And menopause simply referring to 45. Menopause starts from 45 to 55 years. So women between that age have an increased risk of developing urinary tract infection. The next factor is your bathroom habits. After easing yourself, and this goes for women, after easing yourself, how do you clean yourself up? It's very important to clean yourself from front to the back. From front to the back. So you do not do it the other way around, because you will be spreading any bacteria. And the common bacteria that is known to cause urinary tract infection is the E. coli. And E. coli, it resides normally in our digestive system. So when you pass through, there are high chances that it is always that those bacteria, E. coli, will always be there. So if you clean the other way from your anus to the vulva, or towards the vaginal opening, you will be spreading the E. coli to the vaginal opening and into the vagina. So it will cause infection by also entering the urethra. Remember, the urethra is positioned beside or near the vaginal opening and the anal opening. So that positioning also, affects, increase the risk of bacteria entering a woman's urethra to cause infection. Then the next factor is, so it's very important to clean from front to back, not the other way around, to prevent, infection. And also make sure you clean yourself very well and you feel dry before you pull up your underpants. Because if there is any feces or stool, if it lands on your underpants or your panties, and you wear the panties, as you sit, as you walk or exercise, whichever movement, the bacteria or the stool can easily, be spread or to your urethra, and then whichever bacteria is there will cause infection, urinary tract infections for you. So it's very important to clean yourself very well when you use the bathroom. Then there are other factors such as diabetes mellitus or DM. It increases your risk of getting urinary tract infection. And then immunosuppression, when your immune system is very weak or low. Yeah, you become susceptible to all kinds of infections, including urinary tract infection. Then if you had surgery on any part of your urinary system, that could also increase your chances of getting urinary tract infection. Now, having looked at the factors that could, increase your risk of getting urinary tract infection, let's look at preventive strategies. What are the little things that you can do to prevent these infections from happening or from recurring? The first one is drink plenty water. Drink a lot of water. Aim at least 2 to 3 liters of water a day, depending on your activity level, but at least minimum 2 to 3 liters a day. Then you can also use probiotics. These are supplements that maintain the good bacteria level, the lactobacilli level, and pH in the vagina. So you can take this, after discussing with your doctor. You can take probiotics, as supplements to boost the health of the vagina and maintain that acidic medium. But please discuss with your doctor before you buy. Okay, then the next point is you should not hold urine. So once you feel like urinating, just go for it. Go and urinate. Don't wait that, okay, let me wait for some few minutes, let me do this, I'll be there soon. No. Holding urine back, you give the bacteria chance to multiply or grow and cause infection. So once the urine, you feel the sensation, you just go and urinate so that you can flush the system, the urinary system or the urethra of any bacteria that may be there. Then the next thing you should do is to avoid tight pants or tight underpants. You should, wear cotton panties so that it will improve ventilation there, so it does not create that heat or that comfortable environment for bacteria to grow and cause infections to you. Then you should urinate after sex, before and after sex. so that you can flush out any bacteria that may have been introduced there. Then other, good personal hygiene practices you should also do, when it comes to sex is to take a shower before sex. If it's not possible, at least use some water and soap, mild soap, or just water to wash your vulva thoroughly before you become intimate with your partner. And for the men too, even if you do not want to take a shower, at least take some soap and sponge or just water. Wash your genitals well so that you can wash off any bacteria that may be there for the sake of your partner or for the sake of your wife. So you are able to, keep it clean. And then your hands, your fingernails, the men, even the women as well, because women wash with their hands as well during, bath. So it's very important to keep your nails short and clean so that there will not be germs on them if you use your fingers during sexual, activities. And then your tongue, at least, have your normal routine of brushing your teeth at least twice a day to make sure, your mouth is clean most of the time. Then if you use sex toys, it's important to read the manufacturer's, instruction on the sex toy and see how to maintain or care for the sex toys to remove any bacteria on it. So whether you use warm water or whatever as recommended by the manufacturer, you do that before and after use so that you reduce the incidence of getting urinary tract infections through the toys, the sex toys. Then you should also avoid feminine deodorants. And these are products that are made, some are sprays, some are like powder and all that women apply to their genital area. This is not healthy, especially if the product has not been gynecologically tested and approved for use. You want to be very careful because most of the time they will go and these products will kill the good bacteria in there, thereby exposing you to, the bad bacteria, which will cause this urinary tract infections. So please be careful. Don't douche inserting these products into your vagina. Vagina cleans itself naturally through the lactobacilli. So you do not need to insert anything there to clean the vagina. Even when bathing, you only need to splash water to wash the vulva. If you feel the need to use soap, then you use very mild soap to wash the vulva. But using a lot of clean water should be enough. So please do not insert, products into your vagina anyhow, unless they are prescribed by a doctor. So it's very important. Let's take good care of ourselves to prevent all these infections and all that. Please, thank you for watching this video, and please watch out for more of my videos. I hope you enjoyed this video. Thank you.